To that at the bottom of the hour. All right, so last week we debated the swine flu vaccine, which, by the way, we have huge shortages of, and how this happened. But, you know, in light of the fact the government wants to take over health care, we've known since the spring that this was going to be a big problem. You know, how is it possible that we have so many shortages? Apparently, they don't even have enough for the president and the first lady, although it has now been revealed that their daughters apparently got their shots. But there's still a lot of questions in the minds of so many. Now, last week when we had two doctors on, a lot of people that are against the vaccine called me, wrote me, emailed me saying it was unfair. I should have had the other side on. So we wanted to pick up this debate because I know there's a lot of concern about people about any vaccine that you're going to get, and especially when you're talking about your kids or your elderly parents or grandparents. You know what? You want to know the facts. So we decided to bring on two doctors with two very distinct viewpoints on this. Dr. Donald Murphy is the Director of Pediatric Infectious Diseases at the Cook Children's Medical Center in Fort Worth, Texas. And Kent Holtorf is the Medical Director at the Holtorf Medical Group. Guys, welcome to the program. Thank you for being with us.
Hi, John.
Thank you, Sean.
All right, Kent, you're against giving people this vaccine, this swine flu vaccine. Why?
Well, in terms of against, I just really think we need to know the risk and the benefit. Everything is a risk and benefit. So I think there's a lot of unknown risk with this vaccine. And I think in general, the safety of vaccines has been significantly overreported.
Well, explain, though. I mean, what are the risks that you see in getting the vaccine?
Well, we see people devastated by the vaccines in general. We have a center where we basically treat conditions such as chronic fatigue syndrome, fibromyalgia. And we have people call every week saying, I got the flu vaccine or another vaccine. 2 days or 2 weeks later, I was devastated. Also, you know, the controversy with the autism-associated vaccine.
All right, well, hang on one second. Before we jump to the autism and the mercury and some of these other vaccines, I mean, what percentage of people are reporting either fatigue or because, look, when you get a vaccine, you're getting a mild dose of the flu, really. I mean, so that your body works to build up its immunity. So that's fairly common, isn't it?
Right. Well, no, that is. But these are people that for months and months never the same sense. I get so many emails now, especially from the military, a lot after the anthrax vaccine. For instance, one email 3 days ago, woman totally normal, got the anthrax vaccine. 2 days later, terrible muscle pain. I mean, can't get out of bed, fatigue, brain fog. They're saying, oh, you must have MS. It has nothing to do with the vaccine. And over, these patients call and say they can, you know, they're not the same sense, and the doctors say it has nothing to do with it. So it is so underreported.
All right, so you're
associated with it.
All right, are you saying that many of the people that have gotten the swine flu vaccine are getting illnesses that they're not recovering from?
Well, no, we don't know about the swine flu vaccine. Again, all this is so underreported. I'm saying vaccines in general. There are certain populations of patients that are predisposed to these problems. You don't know if that's you or not, but they end up being devastated by these, and it goes unreported.
All right, because I've gotten a flu shot pretty much every year for the last number of years, and I've never had any reaction to any of that.
And that's always the argument, but same thing, the argument was, oh, I smoked for 30 years, and I never got cancer. You know, so it's certainly a small percentage.
Do you not give vaccines at all? For example, polio and smallpox. Do you recommend people not get them?
No, I mean, this is the whole thing. I take it, you know, one by one. We do over 40 vaccines in these kids. And, you know, so, yeah, you can, you know, polio, you need polio vaccine, but we're way over vaccinating kids. The hepatitis B. These kids should not be getting hepatitis B vaccine right when they're vaccinated. And that's a new study that just came out showing threefold increase in autism with the hepatitis B vaccine.
All right, and Dr. Murphy, your thoughts on it?
Well, Sean, I don't think you have to look very far to see what are the differences in societies where we do good public health and good vaccines versus societies where we don't. We can go to any third world country and see if you stop immunizing kids, what happens. And what happens is you have lots and lots of sick kids with vaccine-preventable diseases.
All right, but Dr. Murphy, let me just first stay focused on the swine flu vaccine. You recommend it for children and adults?
Yes, sir, I do. I get my flu shot just like you do every year.
All right, have you seen any of the reaction that Dr. Holtorf is talking about?
There are people who have had sore arms and have had some fever and have felt bad after their seasonal flu shots, and we'll probably see the same thing with swine flu.
All right, how many days after they get their shot, and for how long does it last usually?
Within a day, and it lasts for a day or two.
And that's about it. But then their immunities build up, within 2 weeks, and then their likelihood of getting that flu is greatly diminished?
Within a week, adults have good antibody to the vaccine, to the flu strains in the vaccine, and they should be protected.
All right. Now, what about those that are making the case that in the swine flu case that there has not been really enough time or testing on this particular vaccine? Your response?
There are 9 centers around the U.S. that do flu testing with seasonal vaccine every year and have done testing with the swine flu vaccine. And there's monitoring of those. Not all of that has been done, but several of the studies are done. Probably about 500 people have received the swine flu vaccine as a part of those studies and have finished up, and we've seen that they did respond well, and they did not have unusual or severe side effects. It was very similar to a seasonal flu vaccine.
Dr. Holtorf, have you read the studies Dr. Murphy's referring to?
Yeah, I mean, these are all, again, short-term studies. And you look at, a lot of these, also the symptoms are, occur, they're kind of vague. I have fatigue, I have brain fog, and they get overlooked. They're looking for, severe, what they call severe, like Guillain-Barré, and then those types of things. So, I mean, I think, and it's very small numbers. You look at numbers of kids, some of the studies, 30 kids were included. So I think, again, it's in terms of getting the vaccine, I think the nasal vaccine has an inherent higher safety profile because of the difference that it causes in the immune system.
Well, the nasal vaccine is the live virus that they actually put in you.
Right, but it causes what's called it will cause increased cellular immunity rather than hormonal immunity. What happens when you vaccinate, there's usually a balance in the hormone system, the cellular and the hormonal. And what happens with the vaccine, you drive it to the hormonal side. It's called Th1 to Th2 conversion. Well documented. JAMA, numerous studies show this is very clear. And what conditions are associated with that called Th1 to Th2 shift? Autism, ADD, asthma, allergies, and we're looking at all those conditions are exploding in our society. Are they vaccine related?
All right, but now here's the dilemma that most of our audience are facing, especially as it relates to their children. We have over 1,000 swine flu deaths in the country. Now, I know seasonally that we lose about 30,000 people a year, usually because of complications if they get the flu with other